My name is David Brennan, and I'm here at the London Business School 2010 Healthcare Conference. It's a lot of fun, very, very interesting people and very, very interesting subjects.
For those who don't know me, by the way, my name is Likierman and I'm the Dean. First of all, an extremely warm welcome. Thank you also to tonight's sponsors, BCG, PriceSpective and 3i. This event would not have been possible without their support. And I'd like to thank the Healthcare Club, who have organised this extremely professional conference. Healthcare has been in the press a great deal all over the world. It's an increasingly important subject here at the London Business School. David Brennan is the Chief Executive of AstraZeneca, one of the world's largest pharmaceuticals, with operations in over 100 countries and a market value of approximately 43 billion, with 62,000 employees. He's also a very nice man. David.
Thank you for that kind introduction, Andrew. I appreciate it. We are in a time of unprecedented change and challenge. Technology, globalization, the ongoing effects of the financial crisis are all going to continue to have a major impact on both our businesses as well as on our personal lives. You know, my overall message is an optimistic one. In our industry alone, last year in emerging markets, our businesses in emerging markets grew 3 times faster than it did in our established markets. And what we see is that as demand for healthcare continues to grow, the type of healthcare required in these markets is also changing. So let me give you one example. By 2030, the number of people across the world with type 2 diabetes is expected to increase from just under 300 million to nearly 450 million. And a third of these people will live in China and India. The Chinese government is spending hundreds of billions of dollars putting in place infrastructure. They're building medical clinics in the more rural areas. They're putting in smaller hospitals. Conventional R&D conducted in the lab is going to continue to play the major role in delivering new medicines to the world. We have a lung cancer drug. It's called Iressa. It proved to be superior to the traditional chemotherapies for first-line treatment of lung cancer for patients who had a particular mutation of their EGFR gene. We launched an app for iPhones and iPads designed to offer educational materials to oncologists and pathologists around this EGFR mutation issue with Iressa. Mobile technology has the potential to dramatically transform the way we deliver healthcare. Hopefully it'll provide some new approaches to treatment so that patients can ultimately benefit from some of these technologies. I believe we can develop a healthcare system in which more people are diagnosed and treated, fewer people are hospitalized, medicines will be viewed as an investment and not a cost.
It's a huge pleasure on behalf of the Healthcare Club to introduce our closing speaker this evening, Sir Nicholas Young, who's the Chief Executive of British Red Cross.
It's great to be here, great to have an opportunity to talk to the healthcare industry about the healthcare work of the Red Cross. Many of your companies support our work extremely generously. Indeed, we depend on your companies to support our work extremely generously. I've brought my collecting box with me, and if any of you want to make a further donation outside, I'll be only too delighted. Our services in the UK already play, well, a small, but I would say significant part in improving patient care in this country. We have quite an extensive service staffed entirely by volunteers, helping patients who have just come out of hospital cope with the quite substantial task of getting on alone in the community without necessarily a caring a framework around them. David Brennan from AstraZeneca has been a very generous supporter of the Red Cross, as has GlaxoSmithKline. Anybody from Glaxo here? Some guy I saw earlier on. Thank you very much indeed. I think I have a little film to show now.
Every minute of every day, a child under 15 dies of an AIDS-related illness. If things are going to change, then young people need to be engaged. And this is exactly what is happening in South Africa, where young volunteers on the front line of the response to HIV are getting the message out through drama, music and sports. Please continue to support us and spread the message, because together we can do even more.
For those of you who do support the Red Cross, I really do thank you from the bottom of my heart. You really are making a difference in some very, very poor parts of the world. For those of you who don't yet support us, see me outside. And thanks to Annie Lennox, who's a great supporter.